everyone. My name is Dr. Yewande Oshodi, and I'm here to talk to you again about another condition that affects children and adolescents known as ADHD. It's actually known as Attention Deficit Hyperactivity Disorder, and the acronym for that is ADHD. At times people also refer to it by saying ADD, and this disorder is one of the disorders that affects children and adolescents and could have impact on their mental and behavioral, outcomes. So ADHD is characterized by symptoms of inattention and or hyperactivity in a child. And oftentimes these symptoms will have been noticed from very, very early on in the neurodevelopmental period as a child is growing, early stages of development. And then the diagnosis oftentimes would be made when the child resumes school and they expect this child to be able to pay attention or sit still and is struggling with doing so. We make that diagnosis using a few, certain criteria. You would expect the child to either exhibit features of inattention or features of hyperactivity, or you could have inattention and hyperactivity together. Oftentimes when people hear ADHD, they are thinking of just hyperactivity, that this child is hyperactive, is not sitting still, and, is not able to learn or be calm. But it's important to note that we also have the inattentive type. So there are three types of ADHD, essentially. We have the inattentive type, we have the hyperactive type, and we also have the mixed type, that's inattention and hyperactivity mixed together. When we're thinking about inattentive symptoms, the symptoms, what would it look like? Inattentiveness could be observed as a child who easily gets distractible, highly distractible, or, is unable to complete tasks, gets derailed when asked to do a chore or an assignment, loses things, is unable to essentially just, give enough focus and attention to tasks at hand for extended periods of time, and hyperactivity could be evident in a child who is restless, fidgety, cannot take turns, always blurting out answers before the questions are even asked. We all know a child or two with these symptoms, and we'll expect that this child has at least 6 symptoms, in either of the groups or even both of the groups, and then these symptoms should have persisted for a significant period of time and is evident at home and in school. We expect it to be present in both settings. It may not be ADHD if this child exhibits these symptoms just at home, for example, or the child exhibits the symptoms just in school. So we expect it to be evident in both settings, and we may be dealing with ADHD. Now, following the detection, maybe as a parent or a caregiver, that this child is restless, is not paying attention, what do I do next? We must get that child seen by an expert so that a proper diagnosis can be made of what exactly is going on. So the child needs to be seen, and based on this criteria that I've mentioned, a clinical assessment will be made. There may be questionnaires that are filled by both the teacher and the parent, that people that know the child, and then these questionnaires can be scored, and clinical assessment from the history and evaluation will be all put together, and an assessment will be made. Now, it's important to note that children with ADHD could also have other comorbid conditions. That's when we say comorbid, coexisting conditions, also along with the ADHD symptoms. This is it's nice to note this so that one doesn't find it strange if we now say that, okay, the child has ADHD, but also seems to have some intellectual disability, or along with that has some other neurodevelopmental disorder. But ADHD alone on its own, the child may still have a good IQ, but begins to fail academically simply because of these symptoms. So from the parents' point of view, what you may observe is that you have a smart child who ordinarily is very smart and, intelligent, but makes silly mistakes because they're not paying attention, or loses their stuff. They take things to school, they don't come back with it. They're losing their pens, they're losing their books, they lose their school bag, they lose their lunch boxes, This kind of child may actually have some degree of ADHD going on that's contributing to why they're so careless, in quotes. They may make silly mistakes, in their notes. They may have some, challenges with even writing, that their handwriting may be very disorganized, And teachers of such children will tell you that he or she is a smart child, but it's just that he makes silly mistakes or he never writes his notes, things like that may be a pointer that could this child actually have something else going on. And it's not that the child is stubborn or the child is lazy or the child is being difficult. At times, such children may actually be the clown of the class. They make other people laugh or they're distracting their peers simply because they are finding it hard to pay attention. And they could be placed for punishments often by teachers that do not understand that this may be a case of ADHD that we're dealing with. So having taken the child to be evaluated, by the experts, these experts will be a pediatrician with skill in diagnosing ADHD or a child and adolescent psychiatrist who recognizes the features and can make a proper diagnosis. Then we'll begin to think about how do we manage it? What is the management? What do we do as a parent, that you've discovered that, oh my word, my child has ADHD. What next? Does this mean this child will not be able to go to school or this child is going to be dependent or something? So after an evaluation, there are treatment methods that have been found to be effective in treating ADHD. The most effective treatment method currently is medication. Now, we know that there are lots of parents that do not want medication. There are also some non-pharmacological treatment methods that could be deployed. For example, when we do diagnose ADHD in a child that is younger than 6, we do not start medications routine, except it is really, really, really bad. We would encourage parents to use a behavioral approach where we're thinking about setting boundaries, helping the child to be organized. Well, how do you expect a 5-year-old to really be properly organized? But just being aware that this child may be a bit everywhere. That may not be the kind of child that you just allow to do what they want, how they want, when they want. You may need to have a less distracted environment, where the child can sit and do their work if they have homework from school, or if you want the child to have a learning period. That's for the younger children. Now, the older children above 6, like I did mention, medication is still an option once the child is 6 and above. Methylphenidate, that's Ritalin, is a trade name for one of the methylphenidate preparations, is an option of medication for treatment. And there is a lot of evidence in research that has shown that children that require these medications, when they are placed on it, oftentimes they do fantastically well. You do have the occasional, the small percentage that may have reactions to these medications. Like we all know, medications do have side effects, Not all medications, are necessarily tolerable for everybody, so there will be the occasional exception. In that kind of case, we do have some medications that are also a different group of medication, the atomoxetine group, Strattera. These are medications that can also be effective in treating ADHD, and we have quite a few others that maybe the evidence is not quite as strong as the methylphenidates, the stimulants, but nonetheless are effective. Back to the non-pharmacological, that's the non-medication strategies for ADHD. Remember what I said, that medication has the best evidence for treatment, but recognizing that some parents just feel, I don't want medication, what can I do? Let me just try and do without medication for us. So we will advise that, well, you can give it a try, but medication will still be the best option. So we have some non-pharmacological strategies that people utilize. There's some evidence to show that reducing the intake of, sweet, sugary drinks have some impact on containing and reducing the hyperactivity in some children with ADHD, or using foods that have colorings, and additives and stuff like that, reducing the intake of that in such a child could be of benefit in those children with ADHD. Now, behavioral methods, like I spoke about for the younger children, could also be helpful. Helping the child with classroom, modifying behavior could also assist. For example, you have a teacher who understands that, okay, I do have 1 or 2 learners with ADHD in my classroom. Such a child may need to be put to sit a bit closer to the teacher. The teacher can, keep directing that child to make their notes or complete their tasks. And such a child may require a bit longer time to complete what they're working on because they're so distracted anyway. And there are a few other tips here and there that may be useful. But like I said, at risk of, repeating oneself, there are many children that, medication has helped and continues to help, and they may need to use this medication for quite a while. I always ask the doctor who is prescribing to educate you about whatever side effects there are, and so that you can work along with the doctor hand in hand to monitor your child and help your child. And there are lots of children who are on these medications. They do very well, at the end of the day. They're able to achieve their maximum potential and able to excel in their areas of endeavor. I think it's important to also, as a parent, to read around ADHD so that you're knowledgeable and you can ask knowledgeable questions so that if there are concerns in your heart, your doctor can, enlighten you and educate you in the best interest of your child. So that will be all for now. I hope you've learned a bit more about ADHD. Till next time, bye-bye.